Well, we just want to welcome you all. Thank you for being here. This is a big day, a long-awaited, much-anticipated event for us in the Republican Study Committee. By way of quick review, for those of you that don't know, I'm sure all of you do, but RSC is the largest caucus in Congress, largest caucus of conservatives. We have 146 members, and it's a good representation of the conference at large. We've been working really hard on a number of issues. Healthcare is one of them. Everyone probably remembers back in March, the president said the Republican Party is going to be the party of healthcare. You watch. And everyone has been watching. I had occasion to talk to the president a few days after he said that, and I thanked him for it. And I reminded him that RSC had a task force that has been working on that issue and had been since the beginning of the year. What we're presenting today, what we're unveiling today, is the product of almost a year now of work. We've been meeting with stakeholder groups, doing the deep dive on research, talking about these issues amongst the membership and amongst persons all across the healthcare spectrum. And we've come up with a plan that we're releasing today. We call it the RSC Health Care Plan. It's a framework for personalized, affordable care. Those are the things that are important to the American people. My name is Mike Johnson. I'm from Louisiana's 4th Congressional District. I'm the chairman of the RSC for this Congress. And I had occasion to talk to the president again this morning, reminding him that today is the big day for the rollout. He was very encouraged by that. Told me that we should go get them. And we are fulfilling the promise that he's made and that all of us made when we run for office. In our districts back home, this is probably one of, if not the top issue on the minds of everyone. The cost of health care has become unaffordable. Many people are being left behind. So what we present today are sound ideas. It's based upon some very simple principles. We can protect vulnerable Americans, including specifically those with pre-existing conditions, with chronic illnesses and serious health concerns. At the same time, we can reduce the cost of premiums and deductibles and the cost of health care overall. This is the product, I said, is a year of long year of research and stakeholder discussions. The design here is to empower patients and their doctors instead of insurance companies and bureaucrats, and that's effectively what we have right now. I'm going to turn this over to colleagues. They'll each share a few words about what we've done and what we're producing today. But I would say this has come up in the interviews early this morning, that this is an alternative to what the Democrats are proposing. They really just have two ideas: either double down on the failing status quo under the ACA, or move us to a one-size-fits-all government-run healthcare system. We think that would be a disaster for the American people. We explain that in the first part of this publication, and the second part is all of our ideas. So without further ado, I want to turn it over to a few members who've been working really hard on all of this with us. The first is Dr. Rouzer Marshall out of Kansas, and he was the chairman of the Healthcare Task Force within the Republican Study Committee that helped lead this effort. So, Roger.
Right. Thanks, Chairman. Congratulations.
Sure.
Yeah. Well, good morning, everybody. Like Chairman Johnson said, I'm Rouzer Marshall. I'm an obstetrician that comes from the big 1st District of Kansas 3 years ago. When I go back home, the most common topic people ask me about is health care. They tell me that the current system is broken, that it's not working, that it's time to modernize it. And when I ask people, well, how would you fix it? What would you do with healthcare? They talk to me about how personal healthcare is. There's nothing more personal than your healthcare. And that's why our plan puts the patient and the physician back in control. And if you contrast that just for a moment with our Democrat friends across the aisle who are running for president, they are actually recommending exactly the opposite of what we're recommending. They want complete takeover of government, complete takeover of healthcare by government, as opposed to we want to put the patient and the physician in control. And if I could talk a second, one of my great goals, and when Mike and I met with the president several months ago, the first thing the president said is, Roger, whatever you do, take care of pre-existing conditions. For 4 years, I woke up in the morning, I went to bed thinking about how to fix pre-existing conditions. Talked to hundreds of members up here, talked to thousands of people back home, doctors, nurses, patients, families. How do you fix pre-existing conditions? And I'm so proud of this product. I think that this will fix it better than anyone else has been able to do. And if I could just explain real shortly, just to give you a basic concept of taking care of pre-existing conditions. We want to protect pre-existing conditions by treating those who are self-employed the same way we treat those who get insurance through their job. Let me say that again. We want to protect pre-existing conditions, the same for those who get their insurance through a self-employed situation as for those who get it from a job. And we do that by expanding portability, giving them the same HIPAA protections that those who get it through the employer-based market. And that's like a belt. But we also offer a suspender. And that suspender is a federally funded, state-ran, government-guaranteed insurance policy, a reinsurance policy, if you would, an insurance pool that would help protect those who have certain health care conditions and who meet certain criteria for a dollar amount. So we're proud of that belt and suspenders approach. I think it's going to impact all the populations, the vulnerable populations, as well as those who aren't so vulnerable. And look forward to maybe discussing a few more points here in a second. I think Debbie Lesko's next.
All right. Well, good morning, everyone. I'm Congresswoman Debbie Lesko from Arizona. It's great to see you here. On the one hand, I serve on the Rules Committee, is one of the committees I serve on, and they had Medicare for All go through the Rules Committee earlier in the year. And, so on the one hand, my Democratic colleagues have Medicare for All. And I tell my senior citizens in my district that they would lose their current Medicare program, they would lose their Medicare Advantage program, and if it's employer-sponsored insurance, they'd lose that. If unions had negotiated their insurance, they would lose that under the Democrat program, and it would be replaced with a one-size-fits-all, government-controlled run program. Well, that's why I'm excited that we worked together on the Health Task Force Committee to come up with an alternative to this socialist program. And that's why I support this plan, because it is for patient freedom, patient choices. It expands the patient choices so that they can choose what health plan and what doctor is best for them instead of having the government tell them. I mean, you've noticed how now they're all most of the Democrats are switching to Medicare for All. They've even dropped their own Obamacare plan. They don't even hardly talk about it anymore, so they even think it's bad. So why would we want to expand on more government control when we should give patients and doctors freedom and choice? I think one side is socialism, the other side is freedom, and I'll go for freedom any day of the year. Thank you. And Dr. Joyce is up next. Congressman Joyce.
Good morning. Thank you, Congresswoman Lesko. As a physician legislator, I'm honored to be here with this group who are dedicated to improving our nation's health care. Today and every day, our goal is to support the American patients, their physicians, their nurses, their medical staff who care for them on a day-to-day basis. The health care plans that we're discussing today, it takes an important step to expand Americans' access to quality care. By developing guaranteed coverage pools in each state, our plan will guarantee that high-risk individuals have access to high-quality care, solidly protecting Americans with pre-existing conditions. Again, our plan will protect those with pre-existing conditions while also protecting states' rights. This is a win for the American patients. The Republican Party is taking the lead to strengthen the health care that all Americans want by addressing pre-existing conditions. The Republican Study Committee's work on this plan, and I'm proud to have been a part of that, is an encouraging and needed step forward. And I'm committed to working alongside President Trump and other members of Congress to deliver effective solutions for all the American people. Thank you for being here today. Thank you for allowing us to present this innovative plan to you. And now I introduce to you Congressman Rouzer, who will continue this discussion.
Thank you, Congressman Joyce, and good morning. We know that socialized medicine does not work. And my personal opinion is this is one of two issues that Congress has to address sooner, much sooner rather than later. The other one would be immigration, and that's a separate topic for a separate day. But health care affects so many things. It's not only personalized in terms of individual care and the quality of care that people get. And we wanted to focus on that so that we can protect, empower, and personalize the care that people receive. That's so critically important. And not only that, it affects so many other things. In the state of North Carolina, we have a 100-plus day budget stalemate, all revolved around Medicaid. This plan, if enacted into law, would address that for the states so that they don't have to worry about that huge budget buster of an issue. As a former member of the state Senate, I can tell you that Medicaid is a big, big challenge for every state all across the country. You get health care right, you address that particular issue for the states, and in addition to that, you help address the debt. Because guess what's driving the debt? It's health care cost related to Medicaid, Medicare, and then Obamacare. You address health care and you get that right, you make it personalized, you make it affordable, you make it accessible, you solve all these problems across the board. Not just the Medicaid issue for states, but the debt issue for our country, and then most importantly, making sure that every American citizen has personalized care that protects, empowers, and really personalizes this issue for each and every one. Thank you. I'll now turn it over to Congressman Roy.
Thank you. Appreciate it. Thank y'all for being here. Thanks to Mike. Thanks to everybody for joining us. This is a great day from my perspective. This is an issue I care passionately about. My dad's polio survivor. My uncle passed away from complications involving diabetes. I'm a cancer survivor. That makes me just like every other American. We've all got these stories. And at the end of the day, my view and the reason I believe in what we're trying to do here is that I think Americans deserve to talk to doctors and to get health care, not to talk to insurance bureaucrats and get the runaround. And I think that's all too often what the American people face. And we're tired of it. Everybody I talk to back home in my district, got doctors who want to provide care and they don't get paid for it. Got doctors who want to provide care and they can't do it. Got people who want to get access to care, they can't afford it. Why? Because the very regulations that my Democrat colleagues have been piling on top of a healthcare system that is broken in the back of it, and then they pile on more regulations now with Medicare for All. They're doubling down on the very problems that are destroying the healthcare system so that we can't unleash the ingenuity of the American people to create healthcare that we can achieve through our phones. I mean, we're in the edge of a 21st century revolution in healthcare that's being stymied by a regulatory state that is denying us the access to what we can achieve through the American entrepreneurial spirit. Look, there's a reason Democrats are running away from Obamacare. Why are they all running straight into and running on something like Medicare for All? Because they recognize Obamacare is a complete and utter failure, leaving people without access to care, doubling, tripling premiums, rising the cost of health care for doctors, businesses, causing businesses to go out of business because they can't afford to provide health care. This is the state of our healthcare system because Democrats have regulated to death. Here we've got a framework which empowers people, allows individuals to go get the health care of their choice, allows them to save money, allows them to save that money tax-free, but importantly allows businesses to provide insurance, provide money into a health savings account so they can use that money to get insurance tax-free. Allow people to have their care, to carry it with them, have portability. End the pre-existing problem before it starts. You shouldn't be trying to solve this on the back end. We should make it to where people have care because they're able to pay for it and go into the market and buy it, just like you do any other service. Food, shelter, clothing. Nowhere else do we regulate it to death so you can't go access to it. So I'm proud to be here with some folks that are providing a framework for us to have a discussion about returning health care to people so that they can get the care that they deserve. The RSC plan, in my opinion, is built on a foundation of driving down prices and ending the problem of pre-existing conditions before it begins, and that's why I'm happy to be a part of it, and I appreciate their efforts in doing it.
Thank you. We'll see if you have any questions. I'll just say before we do that, 3 words: protect, empower, and personalize. As you've heard the theme this morning, we have a big emphasis here in what our framework does. This plan protects Americans with pre-existing conditions and everyone so that they have true access to quality care that's more available to them. We empower Americans with greater control over their health care, their decisions, and their dollars, and then we personalize this so health care can meet individual needs. All those things have been lacking in the current status quo, and we want to improve it, and this is our effort. So, question? Sure.
Thank you, sir. Does this plan replace replace the Affordable Care Act, and is it contingent on a repeal of the ACA?
Well, what we're trying to do is inject new ideas. Some of these are new ideas. Some of them are ideas that have been around a while to fix and repair the American healthcare system. In Washington, everybody likes to use slogans and Washington speak. We're trying to solve problems. The real concern that we have is that for really almost 2 years now, there really has been no effort in this space at all. As I mentioned, the Democrats, those running for president, are on a stage talking about either doubling down on the failing status quo, as Congressman Roy was referencing, or moving us directly onto a big government-run, one-size-fits-all healthcare system. We think that is a bad move for the country. So what we're trying to do is inject real solutions that we know can work into this dialogue and this debate, and these are ideas that can be advanced. This is phase one, by the way, of what will be a multi-phase plan. And there are other ideas that will be coming in the next phase, but this one has sound ideas that we think can meet all these objectives. Not only do we take care of folks, but we drive down the cost as well. And back home, that's what my constituents, all of our constituents, are deeply concerned about. We'll go all the way back. Go ahead. Yes.
Have you guys done any sort of analysis on how this would affect premiums and costs? The new data out from the CMS today shows that Obamacare premiums are down 4% on average this year, and that there's more insurers participating in the marketplace than in past years.
You want to speak to that? Sure.
Right, I would love to. One of the reasons that the premiums are going down are those 12 states that have done 22 waivers and are using their own creativity. So I think that's one of the great predictors of going forward is the states that have started fashioning their own plans are doing much better financially. So we don't have any CBO scores or any type of numbers, but I can just tell you as a physician, as a person who's ran a hospital, as a person who's bought health insurance for 300 people, that whenever you have health insurance that's more transparent, promoting innovation, allowing patients to be consumers again, those same principles have operated in every market across the country, no matter whether it's running your restauranting or going to hotels, it'll work in healthcare as well. I have confidence that if we do everything that we want to do, if Congress is bold enough, that we can drive down the cost of healthcare by some 30%.
Can I add one thing to that, Mike? Sure. The only thing I would add to that is the question always seems to be premiums. Now, I completely co-sponsor what my colleague just said with respect to why premiums are going down. I agree that's why. But let's talk about the price of health care, right? That is fundamentally what we need to fix. We need to make it to where people can go to a doctor and afford care. And that's what we're trying to address. That's what we're trying to focus on. And I think we ought to focus on that issue like a laser.
I think that's very well said, and we make the point, and we have made it over and over. We reject this idea that somehow Americans with pre-existing conditions are thriving under the ACA. It's just simply not happening. It's one thing to check a box and say people have insurance, but if they can't use it, if the deductibles are too high, if the premiums are too high, it's really of no use to them at all. And so the objective here, we believe our moral responsibility is to drive down those costs so that people can actually use and enjoy the health care that they've been given. So let me
One explanation, Mark,
Sure.
is our plan allows those people that are self-employed to use pre-tax dollars the same way you would benefit from if you're getting your health insurance through your job as well. So that's going to be a significant savings for folks as well.
That's right, and expanding HSAs, as has been mentioned, and putting more choice and more availability in the system. Would you go ahead? Sure, go ahead, Doc.
I think it's important that we echo this and solidify this in everyone's mind today, that Affordable Health Care Act no longer became affordable. We have a plan that will provide the states with access to cover those with pre-existing conditions with these polls. People, as Mike pointed out, with pre-existing conditions had coverage that was available but financially unattainable because of the cost of the premium, because of the cost of the copay, and the cost of the deductible. I saw this in my medical practice. I saw how this affected people who could no longer afford the misnamed Affordable Health Care Act. The premiums had doubled and tripled, and a plan that was supposed to provide health care for those with pre-existing conditions exactly did not.
And of course, the alternative, if you believe the estimates, you're looking at $33 trillion almost over 10 years for the single payer, the big government plan that they're proposing. So let me go to another question. Yes.
Yeah, I was just curious what feedback you've gotten from GOP leadership on this and whether it's something that they're going to be endorsing.
Yeah, we've been very deliberate in this process. It's been a very open process amongst all Republicans and among think tanks on the conservative spectrum, among outside groups, and of course stakeholder groups and experts. This has been a very deliberative, open process so that everyone can come in and let their voice be heard. And so we're really proud of that. Of course, the leadership knows exactly what's going on. We had a conference this morning. I made a very brief presentation reminding everyone today is the big rollout day. Told my colleagues I spoke to the president about it on the way into that meeting. We believe that as Republicans, and that I mean all of us, we have a very serious responsibility here, and we take it seriously. Someone asked in one of the pressers yesterday, might have been you, politically, is this a good idea? Isn't this a field full of landmines politically? That's not of great concern to us. What we're concerned about is doing the right thing for the American people. We're going to put these ideas out there. We know there'll be some healthy debate and discussion. We look forward to that, but we have to charge this speech. We have to put these ideas out there because the people are counting on Congress to do this, and we'll take the responsibility seriously. Let me go to the back, and I'll come back. Yes, ma'am.
Thank you. So sort of hammering home on the premiums and the costs, one of the things that I hear in Colorado from constituents talking about this is that it is the cost of the premium, not the lack of choices, but the actual cost. One of you said that you're thinking about a 30% reduction. Are you looking at a 30% reduction from like $1,000 or 30% from $600? I mean, what is the range of the premiums or the cost of healthcare under this plan?
That's a good question, and we'll get into the details and specifics as the legislation is we put pen to paper. But it will be a relative thing, right? So depending on what state you're in and what your premiums are, if you talk about reducing healthcare costs by a factor of 30%, that's going to mean a lot of things to a lot of people. We have specific ways to do that, to achieve that. We haven't quantified that exactly, but we know that the ideas that are being presented are going to have that effect. It's going to drive costs down. And for those that are in the low income brackets who need the additional assistance, the plan includes a flex grant model where, as Dr. Marshall mentioned, there's a federally funded but state administered program where those people are not left behind. That's a big primary concern of ours, is that we really do protect all the American people, and we think we've got a process to do that. So, yes, sir, down front.
If Obamacare is unaffordable, increasingly unaffordable, why not just boost some of the subsidies and make it more affordable?
Well, yeah, that's what some of our Democrat colleagues are suggesting. Anybody want to? I know you all want to jump in. Okay, so the problem is if you have a failing system, the statist, the Democrat, kind of the liberal, our colleagues who are on that end of the spectrum, their knee-jerk reaction is always to just throw more money at it. That is not the solution. All we'll wind up doing is wasting more money if we throw it at a broken system. We believe you have to fix the system itself. And these are the only ideas on the table right now to do that very important thing, to accomplish that task. You want to add something, Rod?
Very simple. That's throwing good money after bad money. It doesn't work for any other business model. It's not going to work for this model either. I mean, you can throw all the money you want to at Medicaid, but is there anything more broken as a physician? There's nothing more broken than the Medicaid system. When I would need to make a referral to a patient, of a OB patient, to say a neurologist, less than half of those specialists accept Medicaid. So it's got to be more than just throwing money at it. I think we need to learn how to be more efficient and better use our dollars as well.
So, I mean, what I would add to it is, we're going to be here for, half an hour? In that half an hour, we've racked up another $50 million of debt. We're racking up $100 million of debt an hour, $2.4 billion of debt a day. The problem we've got is you don't want to throw more money at a system that's broken because government has broken it. You want to find a way to unleash the American spirit so we can drive prices down so that people can go have access to doctors. Like, we keep talking about coverage. You say, let's go to insurance companies. Would you want to call some 25-year-old kid answering a phone in Omaha to tell you what your health care should be, looking down some schedule, and he goes, your MRI is $3,000. Hold on a second. I go down the street and I get an MRI for $400. Right? Somebody goes and they get a direct primary care physician who will say, I can take care of that for you for $112. But if you go to the insurance company, you're being told it's going to be $800. Why? Because we've strangled our healthcare system to death. Right now, I know people in my district who are going and get direct primary care services, including Medicaid folks who are able to actually get coverage or go to health sharing ministries and get coverage and running our broken system that government has caused to be too unaffordable, the absolute opposite of affordability. This system, what we're trying to do, unleashes the American spirit to drive down prices so that people can afford health care again.
We got time for a couple more? Yes, ma'am.
Is this a part of the President Trump's the health care plan that he's been promising?
Yeah, great question. So the administration's been working on a plan very deliberately. They have a lot going on, but they put a lot of time and effort and work into this. As we have developed the RSC plan, we've been in close coordination with the administration to let them know what we're doing. We've kept them abreast of the developments the whole time. And so what we anticipate is there will be an administration plan that will follow this one in a certain number of weeks or months whenever it is completed. And I think there'll be a lot of parallels between what we're proposing and what the administration ultimately presents. We'll, of course, be completely supportive of that. You can't have too many good and constructive ideas in this space. It's everyone recognizes one of the most complicated areas of the law, perhaps the most complicated area. By some estimates, the American healthcare system affects 1/4 of the U.S. economy. With all of its reverberation it has throughout the economy. So this is, we look forward to what the administration proposes. As I said, we've been in close coordination with them in the production of this publication that comes out today, and we look forward to all the discussion that continues in the days ahead. So any final question? Well, we want to thank you all for being here. You've gotten a copy. It's a 65-page document. It's been emailed to you. We'll get you a hard copy here probably by the end of the day or tomorrow, but you have it there. If you have follow-up questions, obviously feel free to follow up with our offices. I want to thank these folks here, these members of Congress, for their hard work, a lot of time and effort on the part of many people, some task force members who couldn't be here this morning, who worked really hard on this. We owe a great debt of gratitude to a lot of people. So thank you all. Thank you for your interest and for covering it, and we appreciate your time this morning. All right.